Hi everyone, Dr. Rich Castellano, the Smile Doctor here at Image Lift. We're here today with a very special friend and person, Marcine. Thank you for coming out today, Marcine, and thank you for letting us share your video.
I'm pleased to be here.
Yes,
Gee,
so
this is wonderful.
We met Marcine 10 years ago, right? And you've done some treatments with us, and Marcine would come out to our seminars. And
Yes.
She was a model, and she talked to patients. And now Marcine, she's such an angel. She's a caregiver and taking good care of, it's just amazing. It's not easy being a caregiver. And today, we're here to take care of Marcine. So we're just going to do a little bit around the mouth and the creases. And so, Marcine, what was it that inspired you to have a cosmetic treatment done?
Well, I just thought that, let's keep it as good as we can and not try to be too far out about it.
Very good.
Just to keep it natural.
Good.
And let it progress. And that's it. Age gracefully. I asked God if He would do that for me many years ago. Just please let me age gracefully. And He answered my prayers.
Very good.
Please.
Well, we're here to take care of you, and it will look very natural. Now, Marcine has a big birthday coming up, so can we share how young you're going to be?
Oh, yes.
In July.
In July, I'm going to be 90 years old.
Amazing.
Yes.
We're so proud. You definitely do not look your age or act your age. And Marcine still has many active years ahead of her, so I'm going to be doing some of the numbing medicine right now. Any questions about our goals for today? Okay.
No,
All right.
we've had this trip before off and on.
We've done some treatments in the past. We had our discussion. Now what I'm going to do is I'm going to move the headrest a little forward here.
Okay.
How is that? Is that okay for you like that?
Oh, that's fine.
Okay, very good. So now that our headrest is in position, if you need to adjust it, let me know. I'm using the Hibba Cleanse to clean around these areas, so we're going to treat some of the little creases and a little plump, but as she was saying, we're not going to do too much. And so, we have patients from all ages, but it just goes to show you, people are living a lot longer, and they're living active lives and full lives. And as you can see, Marcine is a really great smiler, and she lifts up our smiles. So we're honored to know Marcine and work with her and take care of her. Now, for my physicians and students that are watching, I like to use the lidocaine after I've done the alcohol and Hibba Cleanse. Now I'm going to do a little numbing for the lips. So what I do is I'm going to lift the lip here, and then go ahead and close your mouth for me, Marcine. That's perfect. So you're going to feel buzz, and then pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch there. Not too bad. You doing okay, Marcine?
Mm-hmm.
Very good. Everything's looking good. And I tell my patients I'm not in a hurry. If you need a break, you let me know. Okay, Marcine? So this is a modified dental block. This is a submucosal regional, or I'll say it's a local block really, field block that does a good job. And it breaks my heart when patients tell me they had fillers and it was really painful. The numbing medicine can be done with little pinches, and then it feels much more comfortable to do the filler. Little pinch there. Everything's looking good. You doing okay, Marcine? We're on a mission to stop bad plastic surgery. We're here to do things the right way and keep you safe. We follow our ABCs of plastic surgery. That'll keep you safe and keep you on track. We're in Tampa and the Villages, Florida. So our ABC, little pinch there. ABCs of plastic surgery. When you know the ABCs, you make your best choices because you understand the bigger picture. But we're going to blot across here. There's no drooling, I promise. And we'll do a little bit here on the bottom as well. So I'm going to lower the lip. There we go. And you feel buzz and pinch. 1, 2, 3, pinch. So the ABCs of plastic surgery, little pinch there. A stands for area. There's 4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin. Little pinch there. We can polish and repair the skin. We'll go slowly. The 4th area is better than everything else. That's our behavior. You feel small, medium, big pinch there, Marcine? Small, medium, or big, or not too bad?
No.
Small, okay. So the behavior is always the best. None of our treatments look as good as Mother Nature's free facelift. How about there? Small, medium, big pinch? Medium? Okay, we'll go slowly. And the lips will feel really big after the numbing, but that's just the numbing medicine, and that does go away. And then how about there? Small, medium, big, or not too bad?
Not too bad.
Okay, very good. Of course, we ask questions to our patients when their lips feel so goofy with the numbing medicine, but okay. Are you feeling any pain right now?
Mm-mm.
The lips are going to feel big and numb and swollen,
Yeah,
but that's
big and
just,
fat, just like I've been to the dentist.
yes, no root canals today.
All good. I only ever had one, and I don't ever want another one. I'm cured.
No more root canals. Close your mouth. There you go. And then, how about here? Do you feel a little pinch? Thank goodness for lidocaine. Little pinch there. So now I'm going to test these areas. How about here? Do you feel a little pinch? So I'm testing and putting a little bit more numbing through here. Little pinch there. Little pinch there. Everything's looking good. I'm sorry, pinch. So now that's why I'm testing to make sure we're putting enough of that numbing. So now for the corners of the mouth, because I know Marcine wanted to address that, you'll feel pinch on 3. 1, 2, 3. Pinch. Sorry, pinch. So we'll go slowly. So the 4 areas: tightening, volume, skin, and behavior. And then you'll feel pinch here on 3. 1, 2, 3. Pinch. The pinch. We'll go slowly. 4 rules for good plastic surgery and cosmetic treatments. Safety's always first. You must look natural, and you will. We're going to prevent future aging and then get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, that's better than going too far. How are you doing, Marcine?
Okay.
Okay, so we're using the... Yep, she's doing some video with us right now. You need a little tissue? Here, I got one for you right here. Here you go. I'm going to take that for you. Here, and here's another
I'll
tissue.
get another one.
Yeah,
Just
there you
in
go.
case.
Just in case.
You have dry mouth except when somebody's messing with it.
Okay, so now I'm going to focus on the little creases. Now, do you feel a little bit of a pinch there or not too bad?
Not too bad.
If you need a break, you let me know. I'm not in a hurry. So we're just focusing on the little creases. So there's 2 main ways we inject filler. One is directly into the skin, which is what I'm doing now, to thicken the skin and fill little creases. The other way is we do it deep, so there's a little pinch there. When you do a deep injection, it's going to plump and reinflate. So right now we're focusing on the fine creases. You can use Botox to treat these areas, but this is going to get a longer lasting result. But they do work well together if you're up for keeping your Botox going, which you need to repeat that 2 to 4 times a year. A little pinch there. How about here? Small, medium, big pinch? A little bit. And then pinch on 3. 1, 2, 3. Little pinch. Bigger. Okay. So that allows me, you can see the creases just plumping out very nicely. And then little here. There's lidocaine mixed in with the product that we are injecting. So the corners of the mouth are important to address because we get that little downturn. And so right now I'm just thickening the skin and bulking up the area where we lose that volume. So she feels a pinch there. How are you doing, Marcine? You doing okay?
Okay.
She's tough. Again, if you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here with Marcine, 89 years young, birthday, special birthday coming up in July. She'll be 90. So proud of Marcine. We've known her for going on 10 years now, and she's done a handful of treatments that she certainly looks natural, does not look overdone, and Marcine is a caregiver, but today is her day to take care of Marcine. So now I'm going to use a little bit for the volume in the lip. You feel a little pinch there or not too bad? How about here, a little pinching?
Little.
Over here, small, medium, big? Perfect. Everything's looking good. It's very normal as we get older that our lips will thin a little bit more. So we start just in the vermilion border. How about here? Small, medium, big pinch?
Small.
Little pinch. Everything's looking good. Marcine will definitely pass the grocery store test today. If she walks into the grocery, no one does a double take. And family and friends won't figure it out. Do you feel a little pinch there?
Maria says, I would like to see the after. Julie says she looks amazing for 89.
She does look amazing. And the after is right here. By the way, you're looking at the after. Marcine is the after. So we're going to show you her before. And of course, Marcine understands the power of smile and the power of behavior. And she's an inspiration for our smile book. She's always, of course, Marcine has been through a lot in life, but she still keeps such a great, positive, upbeat attitude. The world would definitely be a better place if there were more people like Marcine around, that's for sure. You doing okay, Marcine? How about here, small, medium, big pinch, not too bad?
No.
So I'm just targeting the areas where we get that little crease. You can't take it away 100%, but we'll do the best that we can. Perfect. Little pinch. Little pinch. So now I'm going to go over to the other side and do the same. And we'll just focus on the little creases.
Mary says, wow, she's 89. She looks
89
great.
years young. So proud of Marcine. She's an inspiration, truly.
She said your hair looks amazing. Your
Yeah, she
skin
really
looks
looks
amazing.
good. She said she got her hair cut. She said it was a little short for her, but that's going to grow back. But I like it. I think it looks good. You feel a little pinch here on 3. 1, 2, 3. Pinch. Sorry, a little pinch here. Just feel it. You do a little numbing. Sorry, that's a tender spot. But I wanted to try and get that little crease. And then I'm just going to do a little touch here in the lip. Perfect. Little pinch there. How about here, a little pinching?
Just a little.
She's like, I like her hair. She is very...
Yeah, her hair really looks good for sure. Everybody agrees that they like your hairstyle.
Well, that's good. I kind of liked it, a little shorter than I prefer it, but it always grows back.
Yes, it does. Perfect.
And Julie says, how very kind he is. He really puts you at ease, as tells you everything through the process.
So we're here to make sure that you're comfortable and that you make your best decisions. People are not going to make their best decisions until they know their options.
Susan Ross says she looks awesome and even better than some 60-year-olds.
Oh yeah, absolutely. And then I like to do a little bit of massage. Of course, I use a fair bit of that numbing medicine, so obviously we got to let that numbing medicine settle. But just a little pinching here. Little pinch there. And then we're really going to focus on the corners of the mouth here. Very good. And get you another tissue here. And I'll trade you. Here you go. I'll get that for you.
I couldn't feel it running.
When the lips are numb, it may feel like there's drooling, but there's been no drooling. But
And they feel like they're up under my eyes.
no lips under the eyes, I promise. So Marcine will pass the grocery store test today, but while she's numb, she's going to feel, pluck, pluck, pluck. And that will settle. That's going to take about 30 minutes for that to settle down. You feel pinched there or not too bad?
No, not too bad.
So we're completely done. So let's take a look. Can you see how we focused on some of the creases in the corners of the mouth? Make a big smile for me, big smile. So the smile doesn't come back until the numbness settles a little bit, but it definitely looks natural. How does it look so far, Marcine?
Yeah, it's fine.
Very good. And we're going to show them. So Marcine is the after. This is the before picture that you can see with the around the mouth. The lips are a little more full, and the corners of the mouth, you can see how we filled right there in the corner and through these areas. I'll get that for you here. And so, very proud of Marcine. Now for aftercare, there's no restrictions. You don't need to do a massage. But I like to check in at about, I like to check in, here's another tissue, in about 2 months, where we're going to take some pictures. And if you need us before, you give us a call. Any questions that I can answer, Marcine?
No.
Okay, if you're just joining us, Marcine, 89 years young, she's going to be 90 in July. So proud of her. We give you the hugs and hugs and hugs.
Oh, yes, I'll take them all.
Congratulations, and thank you all for watching. We'll have more videos coming soon. We are on a mission to stop bad plastic surgery. We're here to help you make your best choices and raise your standards. I'm Dr. Rich Castellano, and I'll see you in the next video.